Started.
Thank you. So good morning, everyone. This is MnCHOICES office hours for Friday, December the 8th. We are redoing this session because of technical issues that WebEx was having across the country to make sure that both you have the content in a recorded and available, as well as to ensure we get to ask your questions and you to hear the answers, not being interrupted by audio issues. So let's move forward. So as most folks are aware of, office hours is a conference call where you can ask questions about the MnCHOICES Assessment M&A, MnCHOICES Support Plan MNSP, and the revised MnCHOICES application. We ask mentors, or we invite mentors to come so that they can ask training and technical questions during the call. This is the folks that are on this call today. We also have a new member joining us, Liz Sis. And I should have had her on here, but I realize I don't, but you will see her name on future webinars. This session is being recorded. We use WebEx audio to listen to the session. You are all currently muted. When you need to ask a question, you will raise your hand and we will call on you. When we call on you, we will unmute you. So you're aware. We heard in the last webinar that people weren't aware that the training archive page has both the PDF and the recording. I know sometimes you guys are all busy writing down answers to items. Please remember that you can go back to this page and listen to sections of the office hours call if you do have questions. We're recording both the visual and the audio so that you can follow along and refer back to them. So a few ground rules, just to remind us where we're all starting. We're all here with an atmosphere of good intentions and respect. DHS is participating in these office hours to provide you information that your agency needs. Your agency members are attending the call to use this time to learn and ask questions so they can provide support to agency staff. We just want to make sure everyone knows that we really only want you to ask one question and then get back in line if you have another, unless you have a clarifying question, and refrain from asking any questions that you are already put in on a help desk ticket. And again, the reason for this is to make sure that as many questions are able to be asked as possible. And if help desk tickets are put in, we're working on those answers. And so we would prefer that you not ask them here as well. So our agenda today is really light. We're going to have the help desk provide updates. We're going to do a few slides for the revised MnCHOICES information that we went over in our last office hours call attempt on December the 1st. And then we're going to leave time for questions. You know, team, one of the things I forgot to check in on is Kong here? Oh, I see he's here and he's off mute. Okay, cool. Go ahead, Kong, I'll bring your slide up and I will invite you to go ahead.
All right. Hello, everyone. I'm gonna do the same updates last week, okay? So, I'm not doing anything on the legacy applications, just going straight to the revised MnCHOICES. The first one was about the offline encryption key. That's the key acting like the password that locks your offline mode and logs you in when you need to access offline mode. We've been receiving some requests lately that people wanted to reset their encryption key, and mainly it's because users aren't able to log into their offline mode using that key. Um, we don't have a way to reset the encryption key right now. However, if someone is trying to get into offline mode and it's telling them that they have the wrong encryption key, what they can do is view their encryption key. So they would go to their and do this in online mode. They would go to their profile and then to the accounts page, and there is an option to retrieve the encryption key. The instructions are also on the smart guide. Um, we did get, and this is just reset, a user that we're working with FEI now that their encryption key isn't working. So if you're seeing that and you've retrieved your encryption key or for a user, and when you go to retrieve, you copy the encryption key, paste it into offline mode. If it doesn't work, make a report to us, and we'll uh, try to do a screen share, grab that information, and send it over to FBI. Okay.
So Kong, I was gonna try to show him where it lived. So it lives right
Hmm.
here. If you're in a staff profile and you're in the account icon, it's right here. Sorry, I didn't mean to interrupt you visually
Nope.
before.
Go ahead. That'll give everyone the visual, and it'll help. All right. So with that, if you get, some people will get that, you enter the encryption key wrong, and it'll give FEI's information on there. Some of the errors will give FEI's like contact information, stuff like that. So my next one here is just to tell people, don't contact FEI or the vendor directly. Please use the help desk contact form. FEI has informed us that a few users contact them directly, and they were wondering how the users got their contact information, but their contact information might be on some of those error messages. So just advise users not to contact the FEI directly. Collect the details of the issue and send it on a help desk contact form over to us. All right. The last one I have here is about resetting passwords. When users reset password, like they forget their password, and at the login screen, they try to reset their password, and the password code is going to an unknown email address, or sometimes it might even go to a phone number. What we found is that they need to check two things. One, they need to check, not they, but their primary, or not primary, lead agency security liaison. So that includes uh, like any supervisor could that has a, security admin role. So it would be like a delegate supervisor and a contracted case manager supervisor, something like that. They could check to see if that user has the his or her email marked as primary on the account, and also check in the system account to make sure that same email matches. If that's done, next they can make a request in the Minnesota Service Hub for an activation email be sent to the user. Once that user logs in with that activation email, that completes it, and then going forward, the user should be able to reset their password successfully. So I think on the Teresa, on the last time we did this, you were able to show the
Yep.
difference between the profile, where you check in the profile, and then where to check in the account.
So I'm in the profile, and you can see for this example, we made the email example one DHS, and in the account, it is showing as example one DHS at Mailinator, so they don't match. So in this case, then you would have to send in a system access ticket request if the profile is correct and ask for the account email to be updated.
Yep. And so whenever a user resets their password, their um, their code, reset code, was sent to the address that's in their system account. So make sure that matches with the profile. All right. I think that's all I have.
Okay. Thank you, Kong, very much. So we're going to go through the revised application updates and we're going to do questions at the end. Part of why we want to do this is to make sure that we have significant enough time left for you to ask questions. So our next release for the revised MnCHOICES application is next Friday, December the 15th. This is an item we discussed at our last conference call, and you might have seen it in an earlier communication. But the customized living provider records were having an issue where users were reporting an inability for certain providers in the support plan. They were showing not eligible or the provider couldn't be located in the search. And to remedy that issue, the MPSE staff reviewed service codes associated with customized living providers records, and they updated more than 500 records with the correct, most current customized living 24-hour customized living service code. This should alleviate or eliminate most of the, or at least minimize the inability of users to add a customized living or 24-hour customized living provider to the support plan. I would like to just walk through a little bit about MnCHOICES assessment and health insurance information to make sure that we all stay on the same page about it. One of the items you hear before you create a MnCHOICES assessment is to wait for the health insurance page to no longer display no health insurance record available. It should be instead replaced with some health insurance information. If you've added a person and you've waited a whole day and overnight and the next day you went in and looked at the person and they still don't have health insurance information, some health insurance information, then we would request that you put in a mentor submits a MnCHOICES help desk form so that we can review why that new person doesn't have some health insurance information reporting. So one thing that happens is maybe someone created an assessment, put some information in, an assessor was assigned to it, but eligibility isn't functioning as you expected it to, and it's because there was no health insurance information record when the assessment was created. And how you'll know if that is indeed happening is you'll go to the program specific requirements in the assessment and look under health insurance information. If the health insurance information wasn't available when the assessment was created, this is the message you're going to get: no health insurance information records available. The same message you saw on the health insurance screen. If that occurs, then what you do is you mark the assessment incomplete and create a new MnCHOICES assessment if the health insurance information is there. Another question that we've got most recently is, hey, I can't edit my health insurance information. And what we are realizing is that some folks were thinking that they needed to edit the health insurance information on the health insurance information screen. That is incorrect. The health insurance information is loaded nightly from other systems. It will update itself. If you have health insurance information that needs to be edited, you will do it in the MnCHOICES assessment form. And so what you will see is when you are in the MnCHOICES assessment form, when the health insurance information has loaded, you'll see that the health insurance information under program specific requirements has fields available to you, and you can change the drop down menus to change any kind of updates. So if Medicaid started with not yet applied or not available, you can change it to pending, or if they now have Medicaid, you can change it to Medicaid. So these are available for you to edit the information that was pulled over at the time the assessment was created. We want to take a moment and demo eligibility update because we had a question at our last session about, could you please demo how to do an eligibility update? And so our plan is to have Amy Alexander walk me through how to do it so that you can see it done in real time. So Amy, do you want to talk a little bit about the content on this slide, please?
Sure, thanks Teresa. Hi everyone, this is Amy Alexander. Yeah, and like Teresa mentioned, we're just going to go through the eligibility updates similar to what we did last week, just for those of you that may have missed it. And so the eligibility update, there were some questions about how you find that when you need to start an eligibility update for someone. So on this slide kind of explains how you'll find that. So if there's an initial assessment was the last assessment, and if it's within the required policy timelines, which is 60 to 90 days from the assessment date, the date of the assessment, you'll be able to go in, initiate another assessment, and then you'll select that the person is not a current recipient, and you will be able to go in and there'll be a drop down that allows you to select an eligibility update. And so Teresa will go and show it. So Teresa, I'll have you search for Jessica Jackson, please. Right. All right. Okay. So we'll see her last assessment. You can't really see it from this dashboard, but was approved by MMIS. That was an initial assessment. And so I initiated another assessment. And so Teresa can click on that. And then we'll go into the edit mode. And so let's have you, as the recipient identifier, let's have you put in that she's not a current recipient yet. And then if you scroll down, you'll have to put those dates in. But if you scroll down and you go to assessment type right there, you'll see the eligibility update right there. So that's kind of how simple it is. So you'll just go in and select eligibility update, and then you'll be able, after you fill in the dates and everything, you'll be able to start the assessment.
So Amy, you know what I was noticing that I haven't noticed before that made me go, oh, darn it anyways? Do you see what this says?
Yeah, so yes, I do see that, and I noticed that when I was going through the slide as well,
right?
Teresa. I think, you know, so we did notice as we were playing around with this that you can select that the person also is a current recipient. And that's just the way the system is working right now. So you will be able to see it that way as well. But since they're not currently on a program when you're doing an eligibility update, it makes the most sense to say that they're not a current recipient. But if you go back, Teresa, I think you'll still be able to see it even. So if you change that to current recipient, let's just try it.
Yeah, my point was more about we didn't have the slide naming accurate.
Yeah, and then go to assessment.
If it's policy. Sorry, I was hearing the echo.
Oh, sorry. Here, maybe it's from me.
No, I don't think so.
Okay. So yeah, like you said, there are two ways to do it, which we've just recently noticed, and I think it's because of even last week there were some questions about, well, wait a second, what if you select current recipient? But since they're technically not a current recipient, that's the kind of the policy direction we'd like to have you go is select not a current recipient, and then that allows you to put in the dates for the eligibility update.
Yep. And so for me, I was just pointing out that the reference to the slide, this is really about a change, not a heading. And so I realized we wrote it like a heading. So, okay, thank you, Amy.
Yeah, no problem.
So another question that we've been getting a bunch of is how to add housing stabilization services in a person support plan. And so the slide gives instructions for if the person receives a waiver or if person does not receive waiver services. So you can see the difference between the two is if the person receives waiver services, they select people and community organizations that support me, and then they document the provider rate for services in the text box when they enter the service. And that when the service is entered this way, it is entered this way because it's authorized at DHS and not at the lead agency level. And then the person does not receive waiver services, housing stabilization services is a selectable service in the other support plan type. And so we wanted you aware of those instructions as well. Another question that we got is what happens when we know that the support plan signature section requires the person to sign their plan. But what happens if that person can't sign, is unable to sign? The example that we used is what happens if it's a baby, right? So then they can't sign their plan. So what the instructions are is if the person has someone sign on their behalf, then you have that person sign for the person. So in this instance, Charles Ingalls is signing for Carolyn. And in the name section, you put in the person's name and then you add, in this case, he's a guardian. It could be legal representative as well. So that way it's clear the person didn't sign and who signed for them and what was their relationship, legal representative or guardian. So that's all we have. We wanted to make sure we gave you quite a bit of time for questions. And so, Beth, I would say let's go ahead and take our first questions.
Sounds good. Our first question is coming from Heather S.
Wondering,
Hi, Heather.
hi, can you hear me?
We can.
Yep.
Okay. We were just wondering, so a while ago before an update, there was like a little caret in the upper right corner that would make the screen just a little bit bigger. And then it went away. And so we were just wondering if that was purposeful or what's going on with that.
I've noticed it too. And I've also noticed it when, depending on the size of the screen, I'm going to play with it a little bit, probably not right now, but I've played with it and I've noticed when the screen is either made really big or really that it shows back up again, or at least it shows the ability to widen the screen. I'm not sure why the caret is no longer there. It's possibly just part of the functionality of the application, but when I'm going to sit and play with it on the other side and show you when I finally find what that other indicator is, what it is, so you can see it. But I've noticed it also. So you're correct. The caret is not there.
That would be great. And then can I ask one more quick question?
Yep.
So we were wondering, on the, where it says like MCO, if they have a managed care organization, the only thing that we can choose besides like the actual managed care organization is unknown. Is there a way to put something in, like put an option in there for none, like if they're excluded from managed care? Because we don't like putting unknown, but that's the only other option when they're not on managed care.
So you're hearing silence because, of course, I'm waiting for policy to be able to respond back to you, and they're speaking with each other. So we'll just give them a minute or two.
You know, that would be something that we want you to send in, because
Okay.
we would have to have that go through our enhancement process, the enhancement request process. And so any kind of change like that to the system would be really helpful for us just to get in writing. So
this is what I see once, you said that caret was gone. So what I did is I made it big, as big as I possibly could, so that this would show up. And so the ellipsis will show up eventually, and then you can do maximize screen content. So it allows
the caret made that like the Jessica Jackson go away, and it doesn't seem like a lot more space, but when we're already working with small laptops and already a small screen, it helped a little bit.
Yep, understood.
Okay.
Okay, Rosemary first.
Rosemary from Dakota County. When you were going over the health insurance information, you asked us if you've waited overnight and it's still showing unknown, or for the MALTC, to send in a form. The problem is we'd be sending in an awful lot of forms because
it's not when it's unknown. It's when there's nothing there.
Or nothing. Okay.
No,
so
only when it sorry, I was going back through my slides quickly.
Okay.
If you add the person and the next day it looks like this one where it says no health insurance available, that's when you would send it in.
Oh, okay.
Any information that is here allows you to edit the insurance information in the assessment. So by having the load, it allows for you then to edit in the assessment.
Right. So if you put it in, like some people are experiencing when you first put it in and you don't even wait overnight, it will show up as okay, you know, the MALTC as being, you know, insurance that they have. And then other people are waiting overnight and it still says, you know, unknown. They know they can go in and change that, but I'm worried about the people thinking they can go into creating a MnCHOICE assessment form when they haven't waited overnight, even though it's indicating that it looks fine.
Well, so again, I just want to say this again. As long as some health insurance information is available, even if it displays unknown and you know that that it has a status, this is sufficient, okay? Because they can make edits in the MnCHOICES assessment. That's why we gave you the ability to do it, because now you can make the changes you need to make in the assessment when it changes, even
Right.
if the health insurance information might be not displaying the most current information that you know about the person.
Right. But what I'm saying is, I think I understand that. What I'm saying
Okay.
is people, the typical thing that we tell people is you do the profile and first, and then you wait overnight, and then you go in and create the form and everything should be good. What's happening with some people is that they're doing the profile with the health insurance information and it's not showing unknown, which is what it typically does until you wait overnight. It's showing it's fine. It's completely fine. So
when you say completely fine, what do you mean? It's showing some health insurance information and it's showing known?
Yes.
Okay. I just wanted to make
Teresa,
sure I understood
yeah,
what you were saying.
This is Amy. Sorry, I don't mean to interrupt you. I was just going to
No, you're
speak
not.
to this. So it sounds like, and what you're saying is that the health insurance information is loading, like when you create the person, you're not having to wait until that nightly load. And if
Right.
that's the case, and that's good for us to know, because that's something we can look into. It's something that we're working on for the future to do that, so you wouldn't have to wait till that nightly load. So I'm not sure why it's happening already or why you're experiencing that, but we'll look into it. But as long as it's there, and then I would just do that double check, like Teresa had mentioned. I think it's on the next slide, Teresa. When you create that form, just go in and just make sure that under program-specific requirements, you have those drop-downs. And if you do, you're good. You don't have to wait until that nightly load. As long as it's populated in there, you're okay. And we'll check in on, I mean, it's not a bad thing that it's loading immediately, but we'll check in on it. But thanks for letting us know and confirming.
Yeah.
Yeah.
Thank you. That's it.
Thanks. That's why we allow opportunity for us to ask you questions back and forth, because make sure we're all talking about the same thing. So thanks for your patience with us on that one.
Okay, Jennifer Vandershaft. Oh, sorry, she just moved. Okay, Jennifer, you're unmuted.
Can you hear me now?
We can.
Yeah.
I was just going to make a comment on the last one. I think the health information carries over on persons that were known to the system previously, whether they'd had an assessment. I think that's what we're finding. So that's just a comment. So if there was information in the past and their health information is showing up for us right away. And then my question is, when will the rates be updated in the new system? We know that we've just had the rate management system update in the MnSPA, and you know, everything is good, but now I'm getting reports from our workers that there is no updated rate information in 2.0.
So it will happen with the rates, with the release on the 15th.
Thank you so much. Appreciate that.
Yep, you're welcome.
And Teresa, this is Amy.
Amy wants to.
Yeah, sorry, jump in. I can address just the first statement you made about the health insurance information, and that's right. So there was that one-time data migration of people that we did last spring. I think it was back in March, where there was a data migration of all the people that were found in MNA or MnCHOICES 1.0, and they migrated their information over. So those folks that are already in there, you should be able to go into the health insurance information. Like you said, you'll search for the person, MnCHOICES finds them in the system. They should have health insurance information. The nightly load and this like what Teresa has up on the slide now, is really unique to like new people that you're adding, that you're pulling in from Swindex, the state system that you're searching for it. MnCHOICES isn't finding it and you're having to pull them in. That's when you have to really make sure that that health insurance information loads, which is typically in a nightly load. So hopefully that clarifies, but let me know if there are further questions.
Thanks, Amy. Okay, Bree. There you go, you're unmuted.
Okay, can you hear me?
Yes, we can.
Yes.
Okay. Hi, I just wanted to ask, we have a few case managers who are noting that, say when they get a, customized living from a provider like an assisted living, the provider states, that they are doing like 0.15 hours per day of light homemaking, for example. So when the case manager goes to enter that in as a decimal, it is either rounding it up to a 1 or down to a 0, but are finding that the total rate, like at the end, is correct. So we kind of just wanted to make sure that there wasn't something we were missing, or just in general, I guess.
Amy Rumsa, I'm betting that you are able to speak to that.
Can you guys hear me?
We can, thank you.
Okay. Yeah, this is an issue that we are aware of. The totals are still going to be correct, because if you look at the column that says average daily hours or something like that, that's how they're calculating the daily rate anyways. So we are aware of it. We are going to get that fixed at some point, but you can either, I know there's some concern about giving those copies of the rate plan out when it's not correct, in terms of, it looks like there's no hours when there's supposed to be hours. For right now, the only workaround is really you can print off your screens right from the system, because those are correct. It only rounds them up when you're printing them from the support plan print button.
So
Just print
Amy,
a screenshot, like a pretty much essentially of what we're looking at to send now.
Yeah, and it's not, it's definitely not pretty, but it's accurate for now.
Sure.
And you can just explain that, that's how.
So Amy, what you're talking about is to use the browser print button when it displays on their screen. Is that what you're speaking to?
Well, when you go in the support plan and you go to the support plan print button and you choose to print that's when the problem is occurring.
Yep.
Like yeah.
So if instead they use the browser print button, then it won't do that?
Correct.
Okay.
Gotcha. Okay. We just wanted to make sure we weren't missing something.
Yeah.
Thank you. Kim Perkle.
Back to the eligibility update, is that, just to clarify, is that only to be used for assessments that fall within that 60 to 90 days that are truly that activity type 09 for eligibility update?
Correct. That is correct. Yes.
Okay. Just wanted to clarify. Thank you. That's it.
Yep. Thank you. Okay, Sheila.
Hear me?
Yes, we can.
Okay. Just a quick question on, it's really kind of just a typo that we're wondering about under the eating and nutrition. So the choices are feeds or provides nutrition to self independently, and then the second choice says feeds or provides nutrition to self with. And we're assuming that must be with supervision.
Let me get there really quick. Sorry.
That's what I was doing, the same thing.
So it's the first part is cueing or reminding and or encouraging to ensure the person continues to eat to meal completion. And the second one is close monitoring due to choking risk or supervision throughout.
No, I think we're in different sections. So
I'm bringing it up.
yeah, it's
Are
under the
you, what plan are you
consumption,
using?
the eating, nutrition, consumption, the second one on your screen. The third one now.
Yep, this one. So it says to self with. So what you're saying is there's a typo. That's what you're pointing out.
We're assuming it's supervision, but maybe if at some point that could be clarified.
No, supervision is implied in the children of this question. So Teresa, would you mind clicking on food or provide or feeds or provides nutrition to self with?
Oh, self with,
Oh,
sorry.
no.
Yep.
Next one, yeah.
Yep, I'm sorry. Yep.
That's okay. And then go ahead and click here, and then you'll see, yeah. So then it makes sense because it's with queuing or close monitoring. But the supervision one that you're looking for is the second one. So it's close monitoring due to choking risk or supervision throughout, that the person just requires supervision throughout.
Okay, thank you.
Okay, thank you. And then just so you know, Friday for the eating, that'll change and you'll have a few more options there that will give you an O2 and eating. So the eating and meal prep issue will be taken care of next Friday.
Great, thank you.
Yep, thank you. Okay, Jessica Mendez.
I just have a quick question. So I just assigned myself to somebody and I went into the system and there was already a care coordinator assigned. And so when I did the assessment, her name is all over the care plan.
And Jessica, are you a care coordinator also? What's your role?
Care coordinator. So I like sent her a message like in the system, and I tried to do it that way. And I sent her 2 messages now, and I'm not getting anything back. So I guess my question is, should I now go in, send like a help desk ticket, or because I was hoping to. She's not like listed as like the primary, but her name is all over the support plan. So I can't send out that support plan because her name is all over it.
And are you in the same location? Do you work for the same company?
Nope.
Okay, thank you. So I'll let policy answer what you're seeing and then how they want you to move forward.
Okay.
Thanks.
So just to clarify, you want me to reach out, like send or?
No, I'm assuming they're speaking to each other, typing to each other, and that they'll respond back to you. So
okay.
Don't you just love human communication?
Yeah, it's really great sometimes, and it's been a long week, so I'm like, what do you want me to do? I'm sorry.
I totally get it. I do it too.
Jessica, thank you for your patience. It is an issue that we know, but we want you to submit a ticket and we'll get you directions and we'll work on. It is something that we just found recently and are working through ourselves. And so if you could send it in, we'll get you what you need.
Okay, so send a ticket. Because I just was like, I tried to do it like the proper way, which is I thought was like send her a message, you know what I mean? But I'm not getting anything back. And so like now I'm like, okay, I can't go much longer. So, okay, I'll send a ticket.
Yeah, thank you. We appreciate it. Okay, Heather S.
Sorry, my name was still up, or hand was still up.
Oh, okay, thanks. Alexa Miller. Hi, Alexa, we can't hear you.
She may be double muted.
Oh, wait, no, there she is again. Okay, I'm gonna go on. Alexa, we can come back to you. Veronica Julian.
Can you hear me?
We can.
Okay, great. So I just had a staff stop by my desk because they knew we were doing this call. And she informed me that she completed an initial MnCHOICES yesterday. She pulled the forms offline, the assessment and the support plan. She saved throughout the whole assessment. She did not clear the cache. And when she returned to the office this morning and put her forms online, everything was blank. Nothing saved.
Did she sync, or so did she, when she checked her form back in? Sorry, I was just trying to think if she has to sync it or if she just made sure that it was saved.
Or using the same browser that she checked them out and worked on them in.
I can ask about the browser, but if it is the same browser and everything was still blank,
Yeah, sorry, I had to bring offline so I was speaking correctly up. So I'm assuming she checked them back in, which should have synced her data. So thanks. So
if it's not the browser issue, why don't you send it in and we'll escalate it out to have it be looked at further.
okay.
Yeah, and the reason why Beth is asking you the browser issue is if they have shortcuts made for both Edge
And we've
and
gone
Chrome,
over
so
that.
you know that one. Okay.
Yeah.
Yeah. I just wanted to make sure that you knew that's why we were asking it.
Okay. And what was the sync thing you were talking about, I guess?
Oh, I'll show you. So when they check in, it should automatically sync their data, but they could sync their data and then check in.
Okay.
Sync is just there, so if for some reason you are out in the field and then you do have internet connection, you could sync in between, and check in moves all the data over and checks the forms back in. It does both. So I think just when you send in the ticket, if she can be clear about did she use sync or not, I'm guessing she used check in, and so that we just have the information recorded correctly.
So should we hit sync every time we bring it online?
I don't think that it hurts to sync it and then check it in.
Okay. All right. Thank you.
You're welcome.
Okay, our next question is from Lana.
Good morning. Can you hear me okay?
We can.
Oh, hi. Okay. I have two questions. Hopefully that's okay. My first question is, so I'm an MCO delegate agency care coordinator, and I am working on a CADI person HRA assessment for the MCO, and I'm wondering if this is a known issue or if we should not be doing this. So under assignments, I have myself listed as an MCHO MC Plus care coordinator, and I did not assign myself as certified assessor because the CADI worker, I'm assuming, is going to be listing themselves as well in the new system, I'm assuming, as a certified assessor. But since I only assigned myself as the MSHO assessor, the member is not showing up on my caseload on my initial login screen. So I'm just wondering, is that tied to is the caseload section tied to the drop down of certified assessor in order for the member to show up on the caseload?
So if you are working, I'm going to just ask a few pieces. So if you're working as a delegate to an MCO, when you log in as that delegate, you'll assign that person to that location, that delegate location, and then you'll assign yourself as staff, and that's what you're talking about for care coordinator, correct?
Correct. Yep.
Okay. And then secondly, though, if you are doing if you're the person completing the assessment, you should be assigned as the certified assessor to that person as well.
And my role is only the HRA for the MCO, not the full CADI or MnCHOICES assessment.
Okay, cool. Then you are correct on how you assigned.
So then I shouldn't assign myself as certified assessor, correct?
Correct, because you're not acting in that role. Yep,
sure.
You're correct.
Okay, and so that's the reason why they're not showing up on my caseload, right? Because they're not.
Right, because in that. Well, so I don't know. So let's go back and talk about that a second. So You're in the location that you're logged in as, you're the care coordinator. So if that's the case, then they should be showing up in your caseload. If you logged in as the MCO delegate location and they're assigned as the MCO delegate location, they should occur in your caseload. We have been hearing instances where they're not. And when that's occurring, one of the workarounds that you could potentially use is, I'm just going to open up one of my people and show you, is you could create a task. And then when you create a task for the person, then they will show up in your list of tasks so you can see them.
Okay, I definitely tried that and that worked. I was just, really odd. I was like, wait, I wonder if the certified assessor is tied to the caseload tab on the first
It shouldn't
page.
be. It's the caseload tab is made for you for what you've been assigned to. But if you have more than 20 people in your caseload tile, it's going to show the ones you're most actively working on. So they might not show up in it if you have more than 20. And I think that's what's going on with you. That's why I was asking you a bunch of questions.
Sure. No, absolutely. Yeah, that makes sense. Good to know. Thank you for that. And then my other quick question, we had some staff wondering how, so how early on can they start prepping their assessment and support plan in the system? So for example, I have some staff that are busier in the summer than in the winter months, and they're wondering if they go in now on their off time, can they open and prep and support, a MnCHOICES and a support plan ahead of time, whether it's 30, 60, 90 days, like, is there, an issue with that in the system at all? Is it going to auto close or anything like that?
I'll let policy answer that question.
Yeah, there's not it's not going to close anything. It's okay to start ahead. The only thing I would think about is, no, as long as you're not completing that assessment ahead of time, it should be fine. Sorry, I was going through scenarios in my head really quickly, which I didn't share. But it should be fine. You can start.
And not filling in the date field. Sorry, Beth, not filling in the date fields. I ran totally over you.
Yeah, no, well, you could initiate your assessment and start that prep work. So and then add in, your activity date and effective date fields later. Make sure not to move that support plan into in progress assessment complete, because no assessment data is going to come over. But you'll want to make sure to, you can start that prep work in the beginning, that you would do. That's okay.
Sure. So when it lists the support plan, like created date and the MnCHOICES created date, it's not going to mess with anything if they go in, 60, 90 days later and they're like, okay, I'm going to meet with my member, do my assessment. It's not going to look goofy on the printout of like, okay, but you created it December 15th, but you didn't get to it till February 15th, right?
Right. You're looking for the activity dates and effective dates, so it should be fine.
Okay, that's awesome. Thank you guys so much. I appreciate it.
Thank you. Okay, Julie Wabrock.
We have some questions regarding goals in the support plan. And we have kind of been thinking of goals as being more broad and then the action items being more specific. So wondering if that's correct. And then do we need a goal for each service? And there has been some talk about the goals need to be measurable, wondering if that's the case. And then wondering if, I know there are some examples in MTZ, Delford, and some other people with different, DD or CADI or whatever. Are those the only examples, or is there anything else for us to look at?
So let me see. How broad for each service? What was the other one?
Measurable.
Thank you.
And then where are examples?
Hi, this is Kathy. I think our direction also has been, I'll first say that sometimes agencies have their own rules and their own best practices. So I just want to say to make sure that you're following what your agency also says. Teresa, can you help me? I don't know if you wrote them down. Can you say the?
Yep. How broad do they need to be for each service and measurable? And then last one was example.
Yeah. So for the examples, there are examples, like you said, in MTZ, but again, like Teresa explains in training, our examples are more for functionality than quality assurance.
Yeah.
Yeah.
They're not a best practice
right.
example.
Yep, that's a great way to put it. Thank you, Teresa. So I just want to say that, but there's only a few examples in there. And I can look to see, I think you just named them. And then, can you tell me what support plan you're working on, or what you're talking, is it?
Well, I'm kind of asking for other people in the agency, but I guess just in general, you need to you need to state a goal, and then you need to state an action item. So we've been kind of making the goal more broad, and then the action item kind of more specific as how to reach that goal. Is that the correct way to look at it?
Correct. Yes. Yep.
Okay. And then, sorry.
Oh, and then Kathy, is that explained at all in the practice guide for support plan or in the SMART guides for support plans? I just wanted to make sure I asked that.
Yeah, that's a great question, Teresa. I would have to look, but that is a good reminder to go in the help center. In the help center, we do have documents about the support plans.
I'm gonna go look while you guys talk.
Yeah, yeah, thank you. But I don't know off the top of my head everything that's in them, but those are good resources too. Did I answer your questions?
Well, just a couple more. Then, do we need a goal for each service? Like if a caddy case has, they've got PERS maybe for a lifeline, and they've got meals, and they've got homemaker, and they've got PCA. Do we need goals for each one of those services?
So is it goals for service? Well, is it goals for services, or how does the service reach the goal? Right? Like, which is the relationship order?
Yeah, I'd have to pull up a support plan so that I can see what.
I think I can help here a little bit with for goals. That it's not a required field under services that support me, and so if the services, if it doesn't pertain to a goal, it doesn't have to have a goal tied to it. It's more just to tie it together when it does. That you have that ability. So, but goals is not a required field in that area.
Okay.
But it's really there if you're having that service meet a goal to tie it to it.
If it'll help meet that goal, it's not,
right,
services,
right.
Might not always meet that goal, but if it might help to achieve what the person is trying to do, then yes, you could tie it together in that way, and that's why it's there.
And so, did we answer the measurable question that she asked? The measurable portion of the question?
We're a little further down in the questions. Julie, can you help us out with what exactly you're looking for again there?
Well, yeah, I think, I guess just in different trainings and conversations with DHS, I think sometimes it's been said that goals should be measurable. And so I don't think this came out of, any of the revision stuff per se, but just wondering, like, when an audit comes, are they going to be looking at our goals and saying, is this a measurable goal?
Victoria, do you want to speak to that a little bit?
Sure. Hi, everybody. Yeah, I'll just piggyback on both what Kathy and Beth have said. I think it's best practice that people write goals that are in the SMART format. I do believe there's training on how to write SMART goals. I'd have to, do a little research on that. I don't have that resource right on the top of my hand. And I would say that, yes, you can use multiple goals because we all know that it could take multiple services to meet one goal. So you can use the same goal within those services. Hopefully that helps.
Yeah, I think that does help.
Additionally, on page 21 of the support plan guidance is where we give direction about goals. So it starts on page 21. So you could use that as a reference as well.
I was just going to show that. So I went to the help center, and I picked the drop down help and pick the drop down help center. And if you type in the search part, I'm going to put in practice guide. Except for I got to be able to spell well. And then you'll see the support plan practice guide. Currently, I think you have to choose download because I think View has been throwing this failed error, but you can download it and look at the section on goals to see what guidance they provide there too.
Okay, thank you very much.
You're welcome.
Okay. Jessica Mendez, is your hand still up?
Sorry.
We can hear
Sorry.
you.
Yep, sorry. I forgot to take it down. My bad.
That's okay.
Okay, thank you. Erin? Hey, Erin Paredes? Sorry.
Ready.
Ready, thank you. I'll say it right next time.
No, you're fine. I have a question about housing stabilization, just some clarification. I think on the previous MnCHOICES system, the rate was calculated, everything was kind of in there, and it was clear as to what was sent to the provider and how, and it was, so I just want verification that when it's entered in, like where do the rates go in, where does the case manager get that rate? Because that used to be pulled for them. Now we need to go search for it, making sure that the case manager has that. And it's just entered in a field as opposed to like being calculated on behalf or for them. So where's the best, resource for them to make sure they're getting the correct rate entered, or is that not necessary? Knowing that providers are used to getting that as well as units and frequency is on the plan as well.
Right, well, that service isn't going to come out of a budget, right? And so right now, we're working on fixing the other. So when you're creating a support plan and it asks you, like the moving home Minnesota question, and then it asks you if you want other services, that second other isn't pulling in those services necessarily into a waiver support plan. And I'm assuming, are you talking about a waiver support plan? Either way, for right now,
well,
your option.
Yes, but also both, because I'll need to know the answer for both, because we haven't been able to,
Yep.
and it says to create an other support plan. I also wasn't able to find an other support plan, so maybe I'm looking for it incorrectly either, but
We've been asking people to enter it in as services or people and organizations that support me.
Right.
And so then you're entering in that information there. It's not calculating a rate. You can enter in that rate information, in the support information box, text box that you're able to enter in that to just inform the person. But it's not, but that's where we've been telling people to enter in information about housing support services.
For sure. I mean, I guess then the provider is used to then getting something that they can then, so how does that then, how do they have proof that it's been authorized, that they know what the rate is, they know what the units that they can get, like what's the next step for the case manager? How do they now prompt the provider that's not going to get something that looks what it looked like before?
So that's a process, and sorry, I'm learning just enough to be dangerous, but it's a process that DHS works to enter that in when the person is approved for that type of service. So whether or not, I think it's something that, and maybe we'll just bring this back and we'll bring you some more information at our next office hours. I mean, it's how you're able to enter it in, but just to kind of get you a little bit more process information, I think would be helpful. And so I don't want to speak off the cuff. And so let us work to do that, and we'll bring it to you in, oh gosh, January already, guys. Wow. Okay. Is that all right? And if there's something
so in the meantime, I mean, as we're telling case managers what to do, I get how to just put it in there, but it's more of like, all right, so how does the provider then know and then reach out to DHS to bill and making sure that that's all set up? Because it doesn't feel like it's pulling anywhere. Like there's no, I just don't, is DHS then checking the support plans? Like how do they know that we've authorized it then?
Right, I understand. And those are all great questions. And so I want to make sure to get you the right answer. So thank you.
Got it. Okay.
All right. But we'll bring it back and get you some more details on what that looks like for both for both scenarios.
Thank you.
Okay. Thank you, Erin. Okay. Leah Welch. Hi, Leah, are you there? We're still not hearing you speaking. Okay, I'm going to move on. Bree.
Hi again.
Hi, Bree.
We just had a kind of a second question too that popped up. We're kind of having a little bit of problems as far as case mixes, like specifically an example we're thinking of is like a case mix B. One of our case managers is struggling to get somebody to be a case mix B unless she has a level 1 behavior. Is this a known issue, or is it kind of just how the current tool is being reflected? Like prior, the client was able to be a case mix B from verbal aggression or resistive to cares, for example. But now it seems like they have to have like the destruction of property or self-harm, harm to others only that can trigger a level 1 now. So we're kind of just trying to be as accurate as we can. But we have a lot of people who are in places who, switching that big switch from case mixes is going to affect providers and what they are able to bill for the client and everything. So we're trying to just make it as accurate as possible, but also knowing that we want to be able to support like the providers and everything.
Right. Know that you can get an O1 or an O2 with level 2 behaviors. If there's a specific situation where you're wondering about a specific, like what the behavior might have been before and what we have in our current system, you'd want to ask us that, and we can understand what how to get a level or for a level 2. It really it has to do with frequency. So if the frequency is frequent or continual, you're often, let's see, that should rise to the level 2, the value of level 2. But when it's, the frequency is seldom or occasional, it'll stay it'll stay an O1. I think I said level 2 for the other one. When it's frequent or continual, it will be an O2.
Okay, so it's the main thing for us to kind of focus on is the frequency. It's not necessarily the behavior itself. That could be the biggest change and switch.
But I think it gives an O2, but it doesn't flip to case mix B.
It should change to a case mix B. So if it's not, send it in and we can talk through it to see. Do they have ADLs?
They had minimal ADL 0 to 3. So it was difference between an L and a B at that point.
I think I'd want to see that one. We'd want to see that one. If you want to send that in, let's take a look, because that's not our experience with how it's working or how it should work. Well, if you're talking L though, L is a little different, because if you only have 0 to 2 ADLs, you'll still get a dependency for behavior based upon frequency. But 0 to 2 ADLs is an L if you're over 65.
So Beth, I would ask that they just go ahead and submit it in and do a consult, because that's what we're really asking people to do. Because it's more complicated than this, and it's just going to confuse the general audience on when to apply or not. And I know people have an interest in understanding that differentiation and having a better sense of what to do. But I think if I remember right, hasn't our guidance been for those instances where, like case mix B, for example, where they are seeing differences, to submit them in so that we can review them and discuss with them about how to proceed? Yeah.
we'd want to look at it for sure. Because usually we're finding that the system is, I mean, the system's working as it should in those situations. So you might want to just review your resources as well. But if you're stuck, for sure, send it in and we'll help get you there. So
yeah, and I think
thank you.
you know, like per person is different. I think the main reason we wanted to bring it forth here, just to make sure we're not missing anything, is because it's been more than one client. It's been a couple clients that they've seen. So we'll definitely maybe at least send one of them in just to kind of see what's going on, and maybe we can apply it to the rest of the people we're seeing it.
Yeah, we'll want to take a deeper look. That would be good. Thank you. Okay, thanks. Marta.
Hi. Question on the LTC, the screening doc. I'm sure other people can relate. We're experiencing a lot of issues with, and I know we've talked about this before, what's showing there is not, what was reflected on the MnCHOICES assessment. And so we're hand correcting those things, to reflect what they should be and what that MMIS entry should look like. We've noticed just recently this week with a couple of our staff reporting back that if they wait overnight and like print to PDF the LTC the next day, the corrections that they were actually looking for were there. Is this a known issue? Is this just a one-off with a couple of our staff?
The screening document should update every time you save. So if you've made any changes to your content within the assessment, and then you do your assessment results and then you save your screening document, when that green bar that is fully saved, that green bar goes away, you click print and your LTC fields or DD screening fields will be updated. So it's not a matter of waiting overnight to have it happen. It's a matter of making sure you save it, wait to save it before you print. Don't wait until it's fully saved to print.
Okay. So that must have just been.
Yeah, if you did it before while the green bar was there, it's not going to update correctly. And so you'll want to make sure to give it the time it needs to update the screening document. So walk it through the save.
Okay.
This is Kathy. I just want to reinforce what Beth said, because we find that we get tickets, or we've been getting tickets in the past frequently about some issues with the screening doc. And so, like Beth said, anytime there's any changes in the assessment at all, you have to press get results and then go to the screening doc and save it. And like Beth said, and then print it. I have not heard of any example like what you described, that people are having to wait a whole day.
Okay. No, thank you for that. I don't know if there's going to be, we're kind of trying to formulate something internal too as kind of a job aid or process flow, because what we're noticing too is like when a previous EW member doesn't meet level of care anymore, or those specific, doesn't meet level of care anymore scenarios, and we need to exit the waiver and do all the things. CCs are really struggling with this time consuming process of, going back into MMIS, trying different codes. That's not working, coming back. So is there any guidance out there right now on how we maybe do those hand corrections on the LTC, or know kind of how to get those successfully to be entered?
So you're saying successfully entered in MMIS?
Yes.
I'm sorry, I'm missing the beginning of your question. So you're following, are you looking at the current functionality document for known issues and having to make hand corrections there? Why else would you be making, I missed why you're making hand corrections on the LTC?
Yeah, we're noticing that a lot, like when we go to, and I'm hopeful that our staff knew this, what you guys just reiterated, and we can reiterate that again, that of course, make sure it's, it's saved, or you're saving after everything and then going to print. What we're still noticing is that there's still some discrepancies as to what's showing on the LTC or the screening document versus what was actually inputted in the assessment. And I guess the issue is kind of twofold, is then furthermore, when we're noticing even kind of more issues with getting a successful MMIS entry when the member no longer meets level of care when they were previously open to EW, or maybe this is an initial, they wanted an assessment, we're just trying to prove that they're no longer eligible, or not eligible after the initial. We're not seeing what needs to be on the LTC there. And so we're trying to provide guidance to our staff as to how to get those LTCs to go through.
I think we'd want you to send those in as you have them, and we would take a look and help you at that time. If you're feeling that the LTC isn't representing what it is that you're looking for.
Okay.
I'm assuming, are you getting, yes, just send it, if you send it in, I'm wondering if you're seeing issues with MMIS saying that they should need a level of care based upon what you've entered, and you're entering in no level of care. And we would just need to send it in. We can give you specific guidance per instance.
Okay. Okay. So it's kind of, you're saying sometimes based off the functionality document, there is just true issues with the data still not being pulled over correctly to the LTC. And so at those times it may just need to be hand corrected. And you're saying at other times just consult.
Okay. I think like what Beth said, so we would want some tickets because I mean, I don't want to just do a blanket statement that if you don't agree with what's on the LTC screening doc, that you just change it, because if there's an issue, we really want to know about it. And I just really want to reiterate, you have to do two things. You have to press get results under the assessment results, and you have to click save for the screening doc. So there's those two steps, and then look at the screening doc. But if there is something in the current functionality document, yes, then you can follow that. But if you're finding a lot of issues, I guess.
Yeah, if it's not on the current functionality document, send it in.
Okay. Thank you.
Thank you. Okay, Carrie. Carrie Arndt?
Yeah, I just have a question. When I believe Teresa has stated in the MnCHOICES revision under the caseload, she had stated that it's whoever will populate is who you're working with, but we continue to see that they're alphabetized.
Sorry, I'm going here. So you're seeing that they're alphabetized. Yep. It has a 20-person limit, the caseload tile does.
Right, but I thought you had stated something, the fact that it's if you're working on one, if it's whoever you're working on will be in that 20. But if you have a lot of cases, it's still just alphabetized. It's not who you're working with or working on, correct?
So it's not, so you're saying in your experience, the alphabetized list is just whoever's in the A's is on the top, not based on activity level.
Correct.
Oh, okay, thank you.
Is that something that possibly could get changed, that it's who you are working on?
We will just take that information back that you're reporting it. Basically, it's doing A, B, C, D until it runs out of 20, and that's who's populating.
Correct.
Okay, thank you.
Thank you. Thanks.
Yep. Yep.
Okay, thanks, Carrie. Okay, Melissa.
Morning, can you hear me?
Yep, we can hear you.
My question relates to the support plan. So we have case managers creating support plans, and I don't know, Teresa, if you have the ability to pull a example up, but it's just usually easier to see it. Under when we enter the services and support, so the individual line items, and we're putting in case management or case aid or paraprofessional support, it's one of those things where it requires an area of need. Those are the different check boxes in the area of need. And for case management and case aid, there's just not a good area of need, I guess, to check. So we end up typically checking all of the boxes because in some way, I guess it meets all of the needs that the person has potentially. But we're wondering if there's certain services where that could be looked at, where that area of need is not a requirement to be entered in the support plan.
Hi, this is Victoria, and I can take this one. So it is okay to click on the person's direct needs, even though you guys are doing an indirect service, and you guys can comment that in the comment section at the bottom of that service. There's a comment box, and you can say that you know, the paraprofessional is indirectly assisting this person with setting up the service agreements. So it is okay to use those direct needs, even if you're doing indirect support.
Okay. Thank you.
Okay, Tiffany Fletcher. Hi, Tiffany.
Tiffany, we've taken you off mute. You may have yourself on mute and have to take yourself off in another place.
Can you hear me?
We can hear you.
Beautiful. Can you demonstrate how to do a revision of the support plan?
Can you say that again a little louder?
Can you demonstrate how to do a support plan revision?
I heard, can you demonstrate how to do support plan?
I think she's asking for revise, to demonstrate revise.
Yeah.
Okay. I will see if I have to see if I have anything that I could use, but yeah, I'll look. What you want me to do is find one with approved in it and then show you how to do revision. Go ahead.
Teresa, maybe this is something, we do have a smart guide for this. So there's a smart guide in the Health Center that would show you how to revise a plan. But maybe this would be something we could prep for to do a demonstration for at our next.
So I'm assuming it's in each of the smart guides for support plan, right? How to do a revised support plan. Correct. So I'm assuming that you can go in here, I'm going to pick download just because.
Revise isn't an option when we try to do it.
So the piece you have to remember is when you have a support plan that is approved, oh heck, I have too many things open in here. You have to use the filter and pick support plan. And then I don't know if I have one in here. That's the issue. Can I just show them Delford? Amy, I just won't open it up.
That sounds good, Teresa.
Yep, go ahead.
So we pick support plan form. You can see, I believe, there's one where it's plan approved. I'm hovering over it so you can see it's highlighted. And see here it shows revise. So make sure to remember to use the filter and select support plan, and then you'll see the functionality of revise.
That was my problem. Thank you.
Yep, of course. That's what I assumed it was.
Okay, well that was fast. Molly Hodge.
Plans. I actually just did one this morning for an elderly waiver client who has an RS tool, and everything, the support plan carried forward when I did the revise, but the data in the RS tool did not carry forward. Is is it supposed to carry forward, or are we always going to have to re-enter all the data for the RS tool?
So currently that's on the current functionality document. That is something that we're aware of and are working to implement a change to have the dates and the inputs, the rate inputs carry over when you revise a plan.
Okay, I must have missed that on there. Thank you.
Okay, thank you. Okay, Danny.
Me?
You're very faint, but yes.
Okay. I'll try to get my mic a little closer. So I am wondering on a CADI waiver support plan, we're running into the issue like for chore services, it's giving us the message that the provider is not eligible to provide the service, but like MMIS allows us to enter that provider on the service agreement. Should I send that in on a help desk ticket to as technical or other, or what's the best?
Yeah, that was actually going to come to our rates team, and they'll work to, and Charlotte, I'm not sure if, but yeah, send that to, it's a policy question, so send it.
Okay,
send it.
Perfect.
It doesn't need to go to the technical help desk, but send it to us and we'll work to figure it out.
Thank you.
Thank you. Okay, Jennifer.
Hi, and I'm just gonna go back to the question on that caseload tile and just request when you're looking at that piece for alphabetization, sorry, if you can also, if it would be possible for an enhancement of, making that unlimited just for our workers. I mean, caseloads at 20s, not in the realm of what our client or what our workers caseloads are, whether it's managed care. I'd say that's probably closer in the 100 range, and waivers are certainly much higher than 20 as well. So just as a future enhancement, we would really love that all clients that are assigned be possible to be scrolled down through. So that's just a request for the future. Thanks.
So for enhancements, if you'll put in a help desk request ticket and mark that it's an enhancement, we would appreciate it because we log them. And then the other item that I just wanted to point out, because my job's to point out functionality, is that staff can use the My Caseload tile to, if they need to find other people on their caseload, since they aren't all displaying on their My Caseload tile. So.
Clearly.
Mm-hmm.
Yep.
So I used query up here, up in the navigation. Then I went to this little filter and you can do My Caseload. And then you can, I just leave this blank and then I just do run query and then it'll show My Caseload. So then I can then access people that way too. So I can click on any of these people. Let's do Bethany Osborne and her profile will come up.
Appreciate that. Thank you.
Sure.
Okay, Heather.
Yeah, just a follow up to something that was mentioned. You were talking about like indirect versus not direct for the need. Is there a way to add supportive services to the support plan for an area of need? That's what we used to put like case management and paraprofessional under, and it just made the most sense.
That would be an enhancement request. So if you send it in. It's a good suggestion.
I have it written down to send it in as an enhancement request, but thank you.
It's good to say it publicly, so that's good too. So thank you. Okay.
We are very close to time. So one more.
We are, and I think we're okay because I'm just going to unmute Jennifer. Jennifer one more time. Nope, she just took her hand down, and then so Jessica will probably be our last question today.
Can you just show us how you got that full caseload one more time? That's all. I just did it so fast.
Yep. So the navigation header is up here.
Uh-huh.
So do you see queries?
Yep.
So I'm going to click on queries. Practice this in MTZ too if you want to. It just makes it easier. Then I use this filter button right here. And see how it says my caseload?
Mhm.
So I'm going to click on my caseload. And then I just do run query. I don't put anything else in here. And then it will bring up my everybody that's in my list.
Perfect. Yeah. It's just, I hate that I can't have a full view of my caseload, so this is wonderful. Thank you so much.
Yep, you're welcome.
Okay, Teresa, we've got 2
Okay,
other
so I'm
questions
gonna
today.
finish with my couple of last slides. I'm gonna leave it in my PowerPoint mode because switching back and forth just takes time. So to remind folks at the beginning of this, we mentioned that I'm going to go back to the top of my slide, that you can go back and listen to this session. It's in the Webinar Archive Disability Services Division. If you click on MnCHOICES, you'll see the PDF there and the recording that is both visual and audio, and I believe it's also closed captioned. So if you do want to go back and listen to something that we said, or if we demonstrated something and you want to see it, you can do that. And then lastly, we just want to say thank you to everyone from all of us here at DHS for the time today. We appreciate the questions. I also, please know we appreciate the back and forth and the clarification, and hopefully we're not causing conflicts when we do that. Our goal is to really make sure we understand what you're asking, and from time to time we'll say, hey, could you please send it in, or you heard me say today, hey, can we take that and send that in, because we want to make sure that we have enough time so as many of you as possible can ask your questions. So again, thank you and for your patience and your understanding, and we much appreciate the conversations we're having together with you. So please have a really good rest of your Friday, and we will see you in January. So thank you. Go ahead, Anna, and end the recording.